All right, cosmetic surgery is one of the most complex topics, and here to enlighten us on the industry and their expertise are Dr. Robert Sigal and Dr. Byron Poindexter from Reston's Austin-Weston Center for Cosmetic Surgery. We welcome you to the show, and this is a great topic, and I think for our viewers, there are a lot of questions about this. So let's start with what makes your practice different than others?
The main thing, I think, is kind of the way we're put together as a group of 4 surgeons in one place. We're always at the same location. We operate at our office facility, and we're really quite a team. You know, there are other practices where they may have 2 or 3 surgeons that are part of their group, but they don't act quite the same way we do. Sometimes we get them coming to us and asking questions, what would you do? And it's like, well, have you talked to your partner? And like, no. Yeah. We talk all the time. We can get away from each other.
To your point, I mean, I've known you for 20 years. Right? We've been partners for 20 years operating in the same space. And there's a couple of things out of that you get. Like, number one, I get a consult from him and the 2 other partners whenever I need one. And it's good to have that.
Right.
But more importantly, almost, kid, the nurses in the office and I see his results, and his results are excellent. And if I don't get my results to meet his results, believe me, I hear about it.
Right.
And then the good news is I can ask him, and we share our tips all the time, and that makes us better.
What are some of the most common procedures that patients are requesting these days?
I think the most common things that we see are the same things that nationally are the most common. Breast augmentations, liposuction. We do a lot of that. And then we do a lot of facial surgery as well. We do more cosmetic facial surgery, facelifts, rhinoplasties, eyelid surgery than most other surgeons in the area, probably about 3 times as much as the usual plastic surgeon.
Yeah, if you look at all the statistics for surgeries done by surgeons that are plastic surgeons that just focus on cosmetic surgery, because there's reconstructive surgery too, but just cosmetic surgery, if you look at all the national data, like Byron's talking about, we do on average 3 times the number per surgeon. So each of us does 3 times the number. And that adds up. I mean, 25 years of that, there's 80 combined years of experience in our practice. And that all just gets dispersed amongst all of us. So.
Hollywood can sometimes give plastic surgery a bad name because there's the people that take it to the extreme. And so what is your message to people that are like, oh, that's so Hollywood?
Well, actually, that's a great answer. That's so Hollywood.
That's so Hollywood.
Because it's very different here. People in the DC metro area, people on the East Coast are much more conservative. They don't want that look, and that's not what we provide. Right. We listen to them, and they say, you know what, I want to look natural. I want to look like nothing's been done. To us, that's fantastic cosmetic surgery. It should not look like something has been done. And so we don't go Hollywood. We go DC.
Yeah. DC is a very hardworking community. It's a very political community to a large degree. You can't look like you're done here.
Right.
You can't. And you know, if you look against nationally, you look at the statistics, breast implants, for example. There are average cc's volumes that are done in different parts of the country. In LA, it's around 400 cc's. In DC, it's about 100 cc's less than that.
So much more conservative.
Much more conservative, much more tailored, easier to recover from.
We've got some before and after pictures to take a look at that you guys have here. And what is this? Oh,
this is a lower face procedure working on the jowls and the neck. And this is an example of what we were talking about where, you know, we collaborated in a sense. I stole some techniques from Dr. Poindexter and Dr. Weston and sort of combined them into something that became known as a FaceTime facelift so that we don't need to make a cut under the chin to achieve that neckline and jawline.
And there's the after. Yep. And for so many people, you must see people that these are life-changing procedures that you are helping them with, whether it's a confidence issue or something. What's that like for you guys to be able to do that for people?
Well, it's fantastic. I mean, it's actually what makes it worth doing. Just going in and doing the job and making, you know, bigger breast or smaller breast or a tighter face, that's a job. Yeah. But when you go in and you can actually make a difference in somebody's life, and they come to you afterwards and say, man, that just was a huge change. That was huge for me. I'm so much more confident now. Then it makes me happy about going to work.
Another before and after here. What are we seeing here?
Same kind of thing.
Yeah, so here you're going to see, if we look at the face, we're going to look at the brows, the upper lids, the lower lids, the cheek and the neck, and we're going to look at how is this face in harmony or not in harmony. So we see a little bit of jowling, some laxity in the neck, and a little bit of a tired look around the eyes. And
oh my goodness.
So here, you see this is a face that's in harmony, that does not look operating.
And this girl's only 10 days out from surgery with this picture.
Wow.
And that's one of the things, we have to get them back into the workplace. We have to get them back into their jobs, into their lives quickly,
right,
and looking good. And so we modify techniques and medicines to make sure that they come out
Well,
quickly.
and that's a
and
great
easily.
question. I feel like people may think recovery time is going to take a long time. Has it gotten, as we've learned more in the industry, gotten better with recovery
has.
time?
Yeah.
It absolutely
Yeah,
has.
some of it's even the anesthesia. We've made changes the past year to our anesthesia regimen. We have our own
Post-op
anesthesia
regimen,
staff
yep,
that decreases pain, makes it easier, less anxiety throughout the process, and they heal faster.
All right, real quickly, final seconds here. The phone number's on the screen. If people want to get started, give them a call right now.
Absolutely, or go to the website, Austin-Weston.com. You can see how it's spelled actually here at the bottom of the screen.
Awesome.
We have a wonderful podcast, PlasticSurgeryNation.com, that explains some of the things about how to pick a plastic surgeon. And there's so many questions about that. That's a great place to start.
Excellent. Gentlemen, thank you for coming in. I hope you
thank
come
you.
back again and talk to us.
I would
Great
love to.
stuff.
Fantastic.
Excellent. We're going to have more of Let's Talk Live right after the break.